Welcome to the Cancer Support Suffolk podcast. Join me, Mark Murphy, and my brilliant guests as we talk about life before, during and after cancer. This month, we're with Elizabeth. I'll introduce you to Elizabeth and we'll hear her story very shortly. And also with us, Charlie Brown, who's lead nurse GI oncology at ESNEFT, that's Ipswich and Colchester hospitals. Thank you both so much for joining us on the podcast this month. Charlie, first of all, tell us a bit more about the work that you do.
Our work is predominantly in oncology on the Ipswich site, and we care for patients with GI cancers. I concentrate on the bowel cancers. My colleagues look after the upper GI cancers, HPV cancers. And our work is to support patients through treatment of cancer, to ensure that they have someone they can talk to, for us to support them in clinic. And also, unfortunately, when we have incurable cancer, we want to help them until the very end and just be part of their whole journey of cancer, not just on the telephone line, really.
Yeah, so it's a for want of a better description, almost a personalised service that you offer for each individual, because they are individuals, aren't they, going through different treatments, perhaps, different feelings?
I think it's really because you have a mix of ages. We have, I think our youngest was 25, two patients in their 80s, and everybody just needs something completely different. And I think we have to adapt as nurses to what's important to everybody. You know, what is important when you've been told that you have cancer, you know, what support do you need? And that can be sometimes not talking for a couple of weeks, or can I just sit and have a coffee with you and you know, I've got cancer, help.
And you're seeing more and more patients at the moment. You're busier than ever, aren't you?
I think we are. And it's quite sad because we have this big shift of patients under 50, which is really hard because I'm 47, I have children, and all of a sudden you're sat in a clinic with someone who's 47 with children with an incurable cancer. And I think that's becoming the norm rather than, oh, that's unusual. I think it's becoming a lot more frequent.
People do get, and we'll talk to Elizabeth about her experiences in a moment or two, people do get the FIT test, the poo test through now at a much younger age. It's down to 50 now, isn't it? I got mine when I was 60 last year, and I did mine and sent mine off, and thankfully everything was okay. For another reason, I had another one done at the GP, that was okay. But it's important that, you know, when you get that, when you're 50 or any age, you should do it, because, as you're saying, you know, even 50-year-olds, it's becoming far more common now, and early diagnosis is crucial.
But it's so important. But also, if you have a symptom, go to the GP and get that FIT test. It does not mean you have cancer. It could be a multitude of anything. But I think when people have a symptom, especially if there's blood, you panic. You know, ask your GP, have that test. Even if in your 30s and 40s, just speak to somebody. It could be absolutely nothing, but we know if we pick bowel cancer up early, it is really curative.
Could be polyps or piles or anything.
Polyps, piles, anything can happen. And also it's, I think with bowel cancer, it's people don't want to talk about poo. And I think if we do talk about poo and we do say, actually have that test, you might sleep better rather than panicking that there's something wrong.
It's not difficult to do, is it?
And it's not a hard test, and it's a really important test. And I think we have to shift in the way we talk about our bowels. You know, I think it's still quite a difficult subject.
I think people, when they do it, have it through the post, do it, should tell their friends. We talked about cervical cancer a few months ago on the podcast. We had two people sitting where you and Elizabeth are sitting, and we had a case study of someone who'd had cervical cancer, picked up through screening, and she said, I make sure my friends know all about it. I said, what do you do? She said, I post on my Facebook page when I've had a smear. And I went, yes. You know, we should be posting on our Facebook pages when we're posting our FIT test off, and talk about it like going for a dental appointment. It's far more important, isn't it?
Just a standard of care. And I mean, I've been in cancer for 20 years, but I've done this for the last 12. And the amount of patients that will bring me, I've got a crocheted poo, I've got a poo mug, and I've got lots of little stickers of poo. And I think it's also with these patients, you know, it's the younger patients often feel quite dirty, they don't want to talk about it with their friends because it's not a pink and fluffy cancer. It's the cancer that's quite, And I think if we start to, I think I had shared a picture of my crochet poo, which was brilliant. I loved it. Someone made it. It's fantastic, But I think if we can say, take that test.
I'll bring you in, Elizabeth, here. Thank you for sharing your story, and people can see you also on our website. There's a film that you made for us on there as well, and you're one of our volunteers here at Cancer Support Suffolk. We love you dearly.
Oh, thank you. I love you too.
But you had the opportunity to take a fit test.
I did, but I didn't do it.
Okay, take us back. What happened?
I think, I'm 66 this year, so it must have been 5.5 years ago, the fit test arrived and I just put it in the drawer because I didn't need to have that, did I? Because I was perfectly all right. And then the following summer, I was really quite unwell all of that summer, back and forth to the GP. Pooing, as it's not a bad word. It's something that we should talk about, as Charlie said. So I was pooing a huge amount. During COVID, we were going out for walks, but we could only go a certain time because I couldn't poo properly. Eventually found out, once the nurse practitioner at the GP surgery sent me for a colonoscopy, that I had a tumour in my rectum. And the reason I couldn't poo, I had to keep pooing, was because the tumour was stopping everything coming down. So it had to come down in little bits, if you like, yeah? So then started the journey with... Charlie was involved in that as well. I started the journey with Mr. Crabtree at the hospital, who's a wonderful man, and Liz Sherwin, one of our trustees, who also is a wonderful lady, and they got me in really, really quickly, and then the journey starts. Did lots of chemo, radio, wasn't very well for about a year, felt pretty rubbish for about a year. Then it was introduced to me that I should perhaps have a stoma, so I had a stoma. That then took the relief off pooing all the time, frankly, and I wouldn't be without my stoma now. I mean, people are quite frightened of it, but to be honest with you, it's much easier to live like that than trying to find toilets all the time, and I can climb mountains now in Gran Canaria, and I can change my bag at the top of a mountain if I want, and I do.
But I think hearing that is so important, because I think the fear when you say stoma, but actually your quality of life is now...
QOL is completely... What, miles away from what it used to be, Charlie, miles away. I remember when I first started chemo, my association with Charlie was she was my part of the team that was sort of looking after me. I don't know what it was called, but I was on a particular chemo, and then I had to have tablets as well. Well, that's before I had my stoma, and it was just flooding out of me. I mean, literally couldn't make it to the toilet. Poor Graham, my partner, had to clear it all up because I was in the shower trying to sort myself out. And I rang Charlie and I said, these tablets, they should stop taking them. I remember just saying, stop taking them. So I stopped taking them. Then we had to work out something else. So I ended up with a PICS line, which is a slower going in sort of thing. Lots of different things happen along the journey, and looking back, I mean, Charlie and I were just talking, it feels like years ago, it does feel like years ago. I then ended up having something called a posterior pelvic extenuation, which is basically everything out for any particular cancers, and they have to take a margin and everything else. So didn't want to have babies, but had everything taken out there: womb, uterus, rectum, Barbie butt. What else were they taking, Charlie? Can you remember? Everything.
Yeah. They call it a scoop sometimes.
Yeah,
they just say, just like patients afterwards will go, it was like a scoop. It's like an ice cream scoop. Everything's gone.
Yeah. And I made the mistake of watching my operation on one of those surgeon. My best friend rang me and she said, you've got to watch Surgeons on the Edge of Life. It's your operation. And I watched it and I thought, probably wish I hadn't watched that now. But, I've managed to black it out. I can now see why I was so under some... completely cut out of life for nearly 2 days because they want to keep me quiet and not move and everything else. But then come through all of that and realise that, you've got to keep going, and cancer was there. I'm under 5 years surveillance with the team at the hospital, bloods, MRIs, CT scans. Had that. I'm just waiting for results on Monday to go and see the oncologist, but I feel absolutely fine. Everything's been NED, which is no evidence of disease, so there's no reason for it to suddenly come back now, 2.5 years later, I don't think. If it has, then I'll knock it back in. But really, you just have to get on with your life, and you've had cancer, but you've got to be positive. And I think all through my treatment of chemo and radio, I used to go in there and think, well, it's not a very nice place to be, but you've got to do it because it's going to make you better, yeah? And I always remember laying on the radio table, and they used to do the scan, your original scan, then scan you pre the actual treatment. And if you heard the click in the table, you knew you were going to have the treatment. And I was just thinking, come on, click, please come on, click, because you wanted to have the treatment to make you better, yeah. So my tumour was reduced, as I say, and I now stoma bag, but I'm now living what I would class as a completely normal life.
And you've been away in Gran Canaria for a few months?
Yeah, we
enjoying
did.
the winter
We did 3
sunshine?
months last year, and then we did 3 months again this year, and enjoyed the winter sunshine. As you say, it's quite a lot of organisation because you have to get all your stoma bags organised. You have to talk to the GP, but once you've done it once, they're fine and they understand. And you talk to your supplier that you've got to take 3 months worth. 3 months, where are you going? Well, I'm going to Gran Canaria for 3 months. Oh, lovely! But everything gets sorted eventually, you know. And my GP surgery now, I have a slightly better opinion of them. I didn't when I first went through the process of 6 months of back and forth. I don't think I'll ever really trust the GP surgery again, if I'm really honest, because I didn't feel that I was being listened to with my symptoms. And it wasn't until I got to someone a bit higher in the chain, if you like, that I was sent for a colonoscopy, and it just went off from that day. Really, that was the colonoscopy.
The amount of times I hear people. I mean, they're very, very busy. In fairness to them,
Yes,
but
yes.
you do need to push. You do need to persist. You know your body better than they do, and I think we know when something's not right, and you do need to push and push hard.
Yeah.
Let me take you back to when that fit test arrived, that poo test. Do you regret throwing it in the drawer?
Yes, it was stupid, but I didn't think I needed to because I am Superwoman, so I didn't need to do that. But obviously I did need to do that because I wasn't Superwoman.
Do you think you had bowel cancer at that point?
I didn't have any symptoms, no, at that point. So that's probably why. I mean, looking back, I should have done it. And my advice to anyone that does it, that gets it come through the post, do it without fail. I still got one the year after my operation, and I still did it. And I don't know if I'll get another one. I don't know how it works if you get them regularly or whatever. But I feel almost stupid that I didn't do it, and I regret not doing it because then I ended up with stage 3 bowel cancer. But I am on the other side of that now, and I'm a much fitter, healthier person for all of that, and mentally and physically, I think.
Because you want to pick it up, Charlie, before symptoms, don't you?
It's really important. So many cancers that we see in our oncology clinic have been picked up by that fit test. They are actually more of an advanced cancer with no symptoms. And I think, and then when you talk to people, I had a little bit of a problem, and I had a little bit of a tummy ache or something, and you can put your symptoms down to anything, and it can be anything, but to have that fit test is life-saving. And I have a family member who was saved by a fit test, and it's just so important. But also definitely not on your own here. So many people, but I threw it out. I'm not testing my poo.
There's 25% of people in Suffolk don't attend their screening appointment, and that includes fit tests. 25% of us. It's a staggering amount of people. And those people, a goodly proportion, only 1 or 2 of us will get diagnosed with cancer. A goodly proportion of those, will have a cancer that could possibly be picked up by that fit test. Why wouldn't you do it? I do not understand it.
I think we can't change people's opinion on pooing. I think it's still very much a taboo subject to talk about. I think people fear colonoscopy and testing. And I know that I was at a meeting and we were talking a lot about the new colon capsule for fit tests that aren't hugely abnormal, which I think, we need to advertise more.
What would that
to say
be then?
to
You
people.
take
So it's a little capsule, it's a tiny little, looks like a paracetamol, but I haven't seen it up close. And then you have a small amount of prep and you take that capsule and it does its thing, you poo it out, and then it's analysed. And that would be for someone that had a low level fit test. So it wasn't a high number, but it wasn't a good number, So you wouldn't, and it stops you having the colonoscopy. But obviously if it finds something, you would carry on to have a colonoscopy. And I think people they just fear it. But actually, the teams are highly specialised.
I mean, let's break it down because someone I know very close has had a colonoscopy very recently. So you have a couple of drinks to take.
Pretty lethal.
Which clears your system out, and it's several hours sitting on the loo.
I actually have to say, I'll just interject there. I think that's easier with a stoma bag because you can just
use
a drainable one.
Patients say that very much. Actually, it is easier.
Just use a drainable one, and you just keep flushing it out. I mean, I usually use closed ones, but just keep flushing it out. Much easier.
And then, so that's cleared your system out. The next day, sedative, isn't it? And then camera
you
or
don't
whatever
have
it is goes
to.
up.
Yeah, you
No.
don't have to do a
But
sensitive
people have
if you
said to
don't
me
wish
the
to.
actual procedure is
Nothing.
nothing.
No.
And I think that's what's important to say to people if you are feared and you think, oh my God, they will give you sedation and pain relief.
Yeah.
You don't go in to suffer. You just actually say, I'm really anxious about this. Can I have something? And I know I have a patient who she really struggles, and the team are brilliant. You know, all these options are there. Talk to your team.
And
Don't
I've had
fear.
colonoscopy by a stoma twice as well now. That's really weird, I have to say, really weird. But it's just a very strange experience. And the guy said to me, do you want to look at it on the screen? I said, no, not really, thanks, no.
But also you have that option. Do you want to have a look? Do you not want to have a look? Do you want to talk? You don't have to talk. You know, and I think if we talk about it and we talk about the procedure, you know, you can watch them on YouTube.
Yes.
You know, there's examples of all of this everywhere. This could save your life. You know, you could have a cancerous polyp. They could cut it off.
Yeah.
That's
There and then.
yeah, exactly. And they'll follow you up and look after you. I think you even get tea and biscuits.
You
afterwards.
do get tea and biscuits
You know,
afterwards,
and I
that's
think
true.
that's it. I think we just have to be more open about testing people and surviving cancers rather than the huge numbers of people that don't survive.
I was gonna say, do you think it's because it's like an inside cancer?
It is an inside
it's like
cancer, and
a
yes.
cervical or bowel cancer is all an inside
It's
cancer. whereas
inside.
A breast, you know, people can look at breasts, you know,
I
whereas,
think you can
yeah.
die. I mean, you know, when you have patients with breast cancer, a lot of it is because you've had a feeling, you've felt a lump, and it's a visible cancer. If you have a skin cancer, you have a look and something's correct. You know, and like with lung cancer, you can. You know, you can have a persistent cough, and so you think of it, but I don't think you think about that with your bowels.
No, I don't
but if
think so.
it is abnormal, lots of people will go, oh, well, I thought I just had a tummy ache, you know, an upset, which it probably is an upset, and the body reacts to it. But I think we just shy away from talking about it.
I mean, the other thing is I lost a dramatic amount of weight very quickly. I mean, I've been wanting to lose weight, aren't we all? But, you know, it just shed off me 2 or 3 pounds a week.
It's a sign, isn't it?
Yeah.
People will say, well, I was trying to lose weight anyway. And I think you, in your head, no, because it's sitting there. But you kind of, you know, the patients that we sit with and we talk to, they will have a story to tell us about what led. But equally, we still have a large amount of patients that have no symptoms. And I think that's really hard because there's not an answer to it. Oh, I was going to the toilet absolutely fine. And it's a difficult thing to talk about when you're young and you've got a diagnosis, that everything, you know, changed in a heartbeat.
We had the Bowel babe, didn't we, Dame Deborah,
Yeah.
who,
Yes.
you know, was an incredible woman. You know, she talked about it, you know, check your poo, all of this kind of stuff. You know, she was unbelievable
She
in
made
what
a
she
difference.
did.
Yeah, she
My
did.
worry is the same happened with Jade Goody when
Yes.
she had cervical cancer. There was a boost in people going for smears because of what happened to Jade. That's disappeared into the distance now, and I do worry about Dame Deborah. The same will happen there, perhaps. So we do constantly need to be talking about these issues, don't we? And
The
keeping it in the
influx of
spotlight.
testing when she did pass away across our sites was huge.
Yes.
When
Same
you
with
know,
Jade Goody and cervical
just
smears, wasn't
went-
it? Yeah.
and I think these effects, you just wish they would continue to ripple.
Do you think the fit test should be a bit? Is it when you're 60? It is, isn't it? Do you think
It's
it should
gone
be
down
earlier?
to 50,
50
but
now.
I think
has it?
I think it's got to come down. I think
think
the
so.
numbers. There's a lot of evidence emerging for colon cancer in younger people, and I think it's just got to be something you could probably just buy over the counter. If you've got that embarrassment that you can go and say,
Well, you can buy Canesten creams and stuff over
exactly,
the counter, can't you?
and
You
can
know, for
you just
vaginal
buy
things.
this and then you know send it off? And I think it's also people just need care and compassion.
And treatments now, I just want to finish on treatments because advances are being made in treatment all the time now. You've been involved in the cancer world for 20 years. The difference back then to now, how different is it?
It's phenomenal. I could make a whole boring podcast for you on the way it's changed. When I go back 20 years and I sit here today, we know so much more about cancer in general. We can tell you. I was at the Genomics Hub in Cambridge Wednesday, and the guy that was talking to us, he said, we are in the middle of this revolution. And the facts that we can precisely treat cancer, and it's in the early phases, but we are now doing pre-op chemo for colon cancer, which is really, it's new. We always have for rectal cancer, but we're doing it in colon cancer. When we have a cancer, we know so much about it, so we can tailor that to your cancer. And I mean, it's in its infancy, but I think the future is going to be really, really interesting.
I mean, the future hopefully will be much brighter for those who are diagnosed. Look, it's been really insightful talking to both of you today on the programme. Elizabeth, thank you very much.
I just want to make a difference, Mark, and try and help people out there, really.
You certainly are. And
I think sharing your story is fantastic, but also
thank you, Charlie.
It will help. Somebody will listen to what you've said and they will go, I don't feel right. But also, I think, being here, cancer support,
absolutely
having a service
hub,
that is making a difference to our patients, a safe space to come and talk. And if you have got a bowel cancer and you feel uncomfortable about it and you want to chat, I've got patients that come here for counselling, and it's made such a difference to their whole outlook. And I think that's something that you should all be really, really proud of.
Well, we've got some fantastic people that do our counselling, fantastic team here. Thank you both very much, Elizabeth. Thanks for sharing your story. Charlie, thank you very much for joining us as well. It's been a fascinating podcast. Thank you for listening to this episode. Now, if you'd like more information about what we do, please head to our website, cancersupportsuffolk.co.uk, or you can call us on 01473 211 884. We're based in central Ipswich. Cancer Support Suffolk is passionate about educating and supporting the people of Suffolk, and as a registered charity, we rely on donations and fundraising to be able to continue our vital work in the community. Thank you very much once again for listening. Cancer Support Suffolk is here to help you. The podcast is the copyright of Cancer Support Suffolk and is produced and managed by podtalk.co.uk, and is supported by the Suffolk and North East Essex Integrated Care Board. For now, goodbye.